Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before we get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. Our first guest today is Dr. Jaclyn Bjelac from the Cleveland Clinic. She's an allergist and immunologist, and she's deeply involved in research and education. Today, we're going to talk about what's changing in food allergy prevention, the latest treatments, and what all that means for families. Here's Dr. Bjelac. Dr. Bjelac, thank you so much for joining us today.
Thank you so much for having me. It's a pleasure.
Food allergies have been on the rise in the past 2 decades, especially amongst children. In the 1990s, the CDC reported that approximately 3% of children had food allergies. A few years ago, according to the USDA, the rate was nearly double, at around 5 to 6% amongst children and adolescents. Why are we seeing the rise in prevalence, and why are you personally focused on this topic?
So clearly in Western societies, including the United States, an increase in what we would call food allergy, the immediate allergic reactions to foods. I want to focus our conversation today on that and not talk as much about food intolerances because the food allergy is what really tends to impact kids. So we see clear increasing prevalence rates. That's probably a combination of certainly increased incidence and also increased diagnosis and awareness, and possibly a component of overdiagnosis too. That being said, we're seeing a lot more food allergy, and it's likely a lot of different reasons why. How we live, what we eat, what we're exposed to. And if there was one reason why, we would have figured it out already. And if I knew why, I'd have a Nobel. But here we are, Nobel-less. And with this increasing rate of food allergies, so now depending on a classroom, at least 1 or 2 kids in every classroom in the US has a food allergy. And that can be very impactful. So if we can prevent food allergy, we can remove all of the monetary and social and psychological implications of living with a food allergy for a child and for their parents and their loved ones. And food allergy prevention is actually very simple. There's really exceptional data, especially for kids who are at high risk of food allergy, that if you feed a child food early and give it to them fairly often, far more likely than not, that child will not have the food allergy. And if you're old enough to eat, you're pretty much old enough for food allergen introduction. So at the Bjelac house, we would feed our kids the cursory purees. And then as soon as they were able to do okay with solids, peanut was their second food, right? Because there's really great evidence for that. And so now my kids enjoy peanut regularly. And you can accomplish food allergen introduction with just peanut butter from the grocery store, which is so powerful. And in a time when it feels like everything is really expensive, especially related to healthcare, it's a beautiful, simple, very cost-effective way to prevent a possibly lifetime diagnosis of food allergy. When I was growing up, which wasn't 100 years ago, but it feels like that, till about 20 years ago, the messaging from your pediatrician when you would take your kid in was don't feed your child peanut till they're about 3. And there were a lot of reasons, but we were practicing that first do no harm, right? We thought that it could be harmful to give a child a potentially allergenic food. And then within the last 10 years, there was this really pivotal study looking at kids at very high risk for developing food allergy. And they said, let's give these kids peanut. And actually, the reason for this study was they noticed that children who grew up in Israel, which is, very Western, had much lower rates of peanut allergy. And these really smart researchers in the UK said, why is that? And in Israel, one of the very first finger foods is something called bambas.
I love Bombas.
They're these peanut puffs covered in peanut powder. And instead of cereals with the holes in the middle of them, Cheerios, like in this country, these babies were eating Bombas. So these researchers said, well, we wonder if giving the peanut early is the reason why they have less peanut allergy. And spoiler alert, the answer is absolutely yes. So they took these kids at very high risk of developing peanut allergy, gave them all peanuts starting between 4 and 6 months of age, and reduced rates of peanut allergy by over 70%, which is huge. From a disease prevention, there are very few other things that we've ever done in modern healthcare with that much impact.
This is research oriented. This is not anecdotal. This is that they
Oh,
studied
yes.
it.
Yeah, the study is called LEAP, Learning Early About Peanut, the LEAP study. And it completely changed the way we practice allergy. And it's changed the way pediatricians talk to families when they come in the office now and they're getting ready to feed their baby at the 4 and 6 month visit. Because now we know when you eat a food, the immune system learns that it's safe. So the earlier we feed it, the less likely you are to develop an allergy. And certainly peanuts the best studied, but we see that for some other foods as well, which is really powerful. And it's really important from the parent perspective. You're not going to cause harm by doing this, right? You're not going to negatively impact breastfeeding rates if that's your journey. You're not going to cause allergy for your child. And as long as you're feeding the food in a safe way where it's not a choking hazard, the risk benefit here is huge. So it's a simple, very powerful intervention to hopefully prevent food allergy in the vast majority of kids, which is really great.
That is amazing. And so, what are the major allergens you're seeing for early childhood? I'm assuming peanuts is one of them. I'm sure there's others too.
Yeah, so in the United States, the two most common are actually milk and egg in kids, but those tend to more often be outgrown as a kid gets older. Peanut has always received special attention because it's a very common trigger of anaphylaxis. So certainly milk, egg, peanut, and then the tree nuts. You have things like cashews, walnuts, pistachios. Sesame is an emerging food allergen in the United States and is now a required label. And then wheat and soy remain on our list of quote unquote top nine. That also includes finfish and shellfish, though in kids, those latter two tend to happen less frequently. And that might be exposure, right? You don't have a ton of 11-month-olds munching on shrimp every day. So for us, milk, egg, peanuts, tree nuts, sesame, and then we do see a fair bit of wheat and soy as well.
So, from your standpoint, early introduction is a key part of prevention, and you're seeing results through studies that early introduction of these common allergens is related to lower rates of incidence. It may not prevent it entirely, but it helps create some physical reactions for the body to get used to those substances.
Natural tolerance. Yeah, it's fantastic. And the data are clearly best for peanut. There's other studies that show for egg. We're not going to do studies anymore on early allergen introduction because we've seen such positive effects. You would argue that if you're withholding any of these allergens, that potential for harm isn't worth it to do a research study. And that's something we always have to be really conscious of, especially with kids. So for all four of my kids, they eat all of their food allergens, all the major allergens within the first 6, 7 months of life. I'm going to be honest with you, I got a little lazy. The last one probably didn't have soy till she was like 8 or 9 months. And then they eat it regularly, right? Once or twice a week. We want to avoid overly medicalizing how we feed healthy kids who don't have food allergy, but it's sort of part of our routine now. And this is a really exciting time where pediatricians and other specialists can impact and empower families to feed their kids these foods and really hopefully create a shift in the trajectory of the prevalence of food allergy.
Is there a link later in childhood between food allergies and other conditions that exist? I know allergists often work with patients with asthma and eczema, and there's all these other conditions that seem like they're somewhat related. You're an expert. I would love to get your insights here.
The answer is yes, is the short answer. One of the strongest predictors of the development of food allergy, it is not oh, my mom had peanut allergy, or even my sibling has peanut allergy. It's actually the presence of moderate to severe eczema. So you have this break in the skin barrier, and perhaps your immune system's meeting foods through the skin first instead of through the mouth. And very appropriately, when your immune system meets something through the skin, it says, oh, this is potentially dangerous, right? When you think about food allergy, it's a very inappropriate response, but it's actually your body trying to respond in a way that thinks it's protecting you. Again, something that you don't need protection from, but here you are. So eczema is very clearly associated with the development of food allergy. I meet many patients who do not have clinical evidence of eczema and they develop food allergy. And most kids with eczema will not develop food allergy. But very clear correlations here, especially when you get to the category of really more of a severe eczema picture, where your barrier dysfunction in your skin is so broken. And then when you have a child who's allergic in nature, we have what we call the atopic march. So you have this allergic march where you start with eczema and then food allergy clearly is in there now too. Then they develop nose and eye allergy symptoms and eventually asthma. And intervening as early as we can in that process to try and halt the allergic march, try and treat that allergic inflammation is really key. But so when I meet someone and I'm counseling them about food allergy, we are asking all those questions. Your pediatric allergist always will. They'll say, are you sure you don't have nose and eye allergy symptoms? Are you sure little Johnny's not coughing at night all night with asthma? These things very clearly go together.
That makes sense. And we went through this journey with my kids because we've
Yeah.
navigated that triangle of those things.
Mm.
One of the things that we also went through, and I found it fascinating because I don't know if there's more research in this space, but what I understand is sometimes young babies, they could have some sort of reaction to breast milk, and there could be some blood in the stool. And then the mom goes through an elimination diet to try to figure out from a process of elimination standpoint what the baby could be allergic to. It was fascinating to me because there's got to be some opportunity for innovation there. It just seemed like such a severe thing for the mom to have to literally cut everything out, all the major allergens, and then just, oh, it's not this. Okay, let me try to add this back in. Can you talk about more of that and what you think about that?
Absolutely. There's huge opportunity there. And I myself went through that exercise with my third. He was character building for a lot of reasons. So he had what we call milk protein intolerance. That's different than an allergy where you create an immune reaction. It's more of a digestion problem. And while we were dealing with a fussy infant and he was bloated and gas in the stool and he was super spitty, that goes away. And most kids outgrow that by the age of 1. But to your point, the journey to figure out the trigger is almost archaic, right? Because it's guess and check. And many families bring their babies to me and say, help me figure out what's going on. And that is a really hard conversation because allergy testing doesn't help you there. What allergy testing is looking for is the allergy antibody, which can cause immediate hives, vomiting, trouble breathing, that anaphylaxis picture, but doesn't relate to the protein intolerance in any way. So I meet these families and especially these moms who want to continue this breastfeeding journey.
So my last question is about your research. As we look ahead, what are you researching and what are you excited about as a researcher in this space?
There's so much that we have yet to learn about the causes of food allergy. And we are exploring so much more about the microbiome and what we call metabolomics. How does your gut immune system respond to the breakdown products of certain foods as compared to others? So I think there's a lot of exciting space there that has yet to be explored. And that's something that our team is really excited about. And then other areas where we've seen just huge growth is treatment of food allergy. No one did anything wrong if your kid develops food allergy. I think that's a message so many parents need to hear because we kind of internalize like a guilt, I think, in a way that we don't for other disease processes, or maybe we do, but Even if you do everything quote unquote right and your kid still develops food allergy, you didn't do anything wrong. And we do have treatments available, which can be really effective. So, a lot of what I do clinically and in research are treatments to try and build tolerance. If you don't have the natural tolerance to begin with, how can we become tolerant to at least small amounts for a level of protection? But then maybe your child can eventually even freely eat foods. And there's lots of exciting developments in the food allergy treatment space. And desensitization is as old as time. It's the same idea as doing allergy shots, right? We generally don't do food desensitization in shot form, we do it using the gut. So, oral immunotherapy is OIT. Sublingual immunotherapy is called SLIT. There's epicutaneous, which is on top of the skin, immunotherapy, and lots of exciting things coming out in the food treatment space over the next few years. It is my fervent hope that there's a true cure for food allergy, not just within my patient's lifetime, but even mine. I would love to have to pivot to a different subspecialty area.
Dr. Bjelac, thank you so much for your time, your expertise, and your thoughts. Really appreciate it.
Thank you so much for having me.
And now a thank you to our generous sponsors.
All right, we want to thank our sponsors for A Dose of Optimism. Our first sponsor is Nabla. Nabla. This will help keep us practicing longer. For 85,000 clinicians and counting, Nabla is the key to better balance. With real-time notes and dictation in one platform, clinicians are saving hours on documentation time and strengthening patient satisfaction. Learn more on nabla.com. And to Mercury Bank, online business banking for startups and small businesses. Go to Mercury Bank for powerful banking, simplified finances. And finally, we want to thank our presenting sponsor, KidsX. KidsX is a global ecosystem of pediatric innovators anchored by a consortium of the leading children's hospitals motivated to accelerate health innovation and transform care in pediatrics. Our next guest, Daniel Zakowski, is the CEO and co-founder of Ready Set Food. His journey started with a personal story. His nephew developed severe food allergies, and that sparked the idea to create a science-backed, easy-to-use solution for parents. Since launching in 2018, Ready Set Food has grown rapidly, and he's even caught the attention of Mark Cuban on Shark Tank, where Daniel landed an investment to scale the company's impact. Today, we're going to talk about the science behind early introduction, the challenges of bringing his innovation to the market, and what the future looks like for allergy prevention. Enjoy this interview with Daniel Zakowski. How did you find your way into Ready Set Food?
So in addition to my dad being a physician, many of my immediate family members are physicians, including all four of my brothers-in-law. But one of my brothers-in-law had a son develop a food allergy 8 years ago, and he'd known his baby was at high risk because his baby had severe eczema. His eczema was so bad that he scratched his scalp until it bled every night for a while, and it was just horrible. So he was looking at other things he should be aware of, and he'd come across this idea that you should feed allergens early and often based on the first study that was released in 2014. Our kids were born in 2014, so it was just around that time that data was being released. He knew he wanted to give his baby that chance at not developing food allergies based on that early data, but my nephew just wasn't very good at eating solid food at a young age, so he waited a couple months until my nephew was more developmentally ready, so to speak, for eating solid food, and by that point it was already too late. And it just seemed crazy that based on the data, it looked like we could prevent up to 80% of food allergies. And we know it would just require feeding babies peanut and egg, but babies at 4 months of age are not very good at eating peanuts and eggs. And that we just saw we needed to make that process easier.
All right, let's rewind the calendar back to the 20th century. In terms of food allergies, how did we get here?
If you think about what life was like before we had the explosion of allergies 20, 30 years ago, if you think about in the 1960s, what was life like? In 1960, the average age in the US, the median age for feeding babies solid food was 2 months of age. Historically, throughout human history, we've been feeding solid food to babies at a dramatically younger age than we do now. Right now, the median, depending on what data you look at, is somewhere closer to 8 months of age in the US. And there's good reasons that we do it later. Like babies can choke at 2 months of age. But if you think about humans being in the hunter-gatherer kind of mode, or even in the early farming communities, there's no way we would have access to enough calories in our breast milk without the help of breast pumps and formula to have exclusive nutrition coming from breast milk. So historically, it's not that breast milk is what prevented it, it's the complementary feeding that we've always been doing, because at some point early on in life, babies just weren't getting enough nutrition and they had to be fed table food. But that leads to choking, and there was really obvious negative consequences of feeding babies solid food so early. So then you had guidelines about waiting to feed food in general until later. And as food started to get fed later and later, you saw the average age going from 2 months of age in 1960 to 7 or 8 months of age in the 80s. You then started to see an increase in the rates of food allergies. And since there wasn't a lot of data at the time about why there wasn't a good understanding in any RCT trials or anything like that that would show what was causing this, there was just a fear of giving babies these allergens because it could cause a reaction in that sense. So then, in the absence of data, the best guess of the doctors was we should delay allergen exposure even later. There was already this trend towards feeding later in life. That problem compounded when the recommendation was added to, specifically, for example, peanut was recommended to be delayed until 3 years of age. That was the best guess at the time because there was no evidence to the contrary. But then we've had, starting in 2014 now, 23 different clinical trials showing that feeding the allergens back the way we used to in the 60s, getting that allergen in very early, prevents most food allergies from developing. There are other components that seem to be an issue. For example, eczema is the biggest risk factor for food allergies, and that's been dramatically on the rise. So it's not only allergens, but if feeding allergens eliminates 80% of the problem, then we know that's really the main driver of this epidemic.
So now walk us through what is Ready Set Food today? What does it involve? Give us the product in a nutshell.
So, product in a nutshell is making it very easy for parents to follow the food allergy prevention medical guidelines. Key product being an allergenic protein powder of peanut, egg, and milk that dissolves in breast milk or formula, so that as early as parents can feed their baby these allergens at 4 months of age, they can get allergens in the diet following the clinical trial guidelines that then prevents 80% of food allergies.
I assume you've got some clinical evidence behind when you're introducing it and the quantities and all of that.
Absolutely. And the great news, although we've not completed yet the trial that's ongoing on our product, there's been 23 clinical trials just using food. So there's a lot known about the dose, how long you should keep going, how early you should start. And the evidence really shows you should start around 4 months of age as early as possible. One of the trials on cow's milk started at 1 month of age, and that found a 90% rate of cow's milk allergy prevention.
You've taken the science and you've basically productized it in a way that makes it easy for families to adopt it.
That's exactly right, because this is an area where the science is settled as far as early allergen introduction goes, but the implementation is very unsettled. So there is a report that came out just a couple weeks ago, and now this is 5 years after medical guidelines came out saying that every single baby should do this process. And it said that 6% of parents report accurately doing early allergen introduction. And part of that's because they don't know how long they should do it, how much, which allergens. Maybe their doctor told them, maybe they didn't, maybe they forgot. There's all these questions parents have, and there's so many topics that need to be covered when they come in for that 4-month well child visit that even with the best intentioned pediatricians and medical staff, often they don't have time to cover it because they're focused on vaccines and sleep and these other topics that come up. So really, our goal is just to make it so easy for the parents that maybe there's 6% or 5% that just want to do it on their own, but there's going to be many that really struggle. And even in the largest clinical trial, more than half of parents struggled to get their baby to eat enough of the allergen. And you only had per protocol compliance on 43% of the parents in that trial. So I think there's both the education aspect that we're trying to help address, as well as just the actual ease of doing it, because both of those are what's leading to the very, very low rate of early allergen introduction so many years after the guidelines came out.
So I assume a lot of families find you in various retail environments, but it seems like you're also working with hospitals and doctors. Can you talk us more about what that pathway looks like and how do hospitals work with you?
Great question. So there's two main ways we work in the healthcare sector. One is with healthcare systems because they need to be providing education on food allergy prevention related to the new medical guidelines. And that we found, especially given that the guidelines came out in 2020, and since then everyone's been quite busy with first COVID and then everything cascading from that, that most systems have not developed their own educational material on this topic. So what we did is we worked with top food allergy experts to develop non-branded educational material that doesn't reference Ready Set Food at all. It just talks about what the guidelines say parents should do and links to high quality non-branded educational sources about those topics. And we've now had 15 different large healthcare systems embed that educational material directly in their electronic medical records so that it's automatically fed out to parents when their baby turns 2 months, 4 months, 6 months, and 9 months of age as part of the yearly after visit summary. And we've also given them dot phrases for high risk babies. So if there's a baby with eczema, it gives additional information on how to deal with that. So by developing these non-branded tools that we give away for free that were developed by leading allergists in the field of food allergy, we've been able to partner with many large healthcare systems to get education out there. Now, that's not going to drive our revenue growth. It's non-branded and it's just education. But the first thing that we need is parents to know that they should prevent food allergies and that they can. Once you know that, why you should use our product is really self-evident, because you can either decide it's easy enough for you to do on your own or you need help. But really, the key question is making sure people know that this is what's medically supported and that it's safe and that it's what every parent should be doing for their baby. That's really how we work on the healthcare system side.
We were talking earlier about Delaware.
Absolutely. So Delaware is an exciting opportunity to expand on what we've started in the last year or so, which is working with insurance companies who are fully paying for our product to be given to parents on their plan. So we'd already launched a program in Missouri with Home State Health, which is part of Centene, and then in Kentucky with WellCare, also part of Centene, where they offer our product to families on their plan. We're seeing about 25% of the parents opt in, and we ship them a 6-month package of ready set food. And it's really a win-win for everyone, because on the insurance plan side, they're saving money from fewer EpiPens, fewer ER visits. The cost of our product is minuscule in comparison with the cost of a food allergy emergency room visit. So we're really giving a win-win. And Delaware now has passed legislation that requires all insurance companies in the state to provide similar coverage.
Your product, I imagine, could add value to many families, but I imagine it may be hard to access for families who are on Medicaid. And as we know, so many families in this country, particularly those with children, are on Medicaid. How is your product accessible to families that are low income or on Medicaid?
That's one of the reasons that insurance reimbursement is so exciting, is that having multiple Medicaid plans reimbursed for our product is really the only way we're going to make this a public health solution. Because as you indicated, something close to half of parents are on Medicaid. And if that's the case, our product is, in air quotes, only $200, but that's still quite expensive for people who are having trouble making ends meet. So for us, the Medicaid aspect of our launches with insurance companies is really important, because from a mission perspective, it helps make sure we can actually address public health in the right way. And from a total addressable market size perspective, it makes us able to address really the whole market. And the last thing I would add is we've actually even had more traction on the Medicaid side with insurers than on the non-Medicaid side. It's horrible that this is the case, but lower income families have more food allergy emergency room visits, about 2.5 times than the average. So there's dramatically higher costs. So we have an opportunity to really make a difference in these people's lives and also save money for the insurance plan in a way that makes it a real win-win for everyone.
That's interesting. So you're saying Medicaid families are more likely, perhaps twice as likely, to have a food allergy related emergency department visit than a non-Medicaid family.
It's horrible from a quality of life perspective when you think about what that means for the family and how we're able to hopefully then affect the future families not having to do that. But it's also a good reason why insurance companies then want to step in. And then especially on the Medicaid side, see that other areas that typically will support low-income families have not stepped into this area. For example, like WIC actually specifically excludes all peanut-containing products from their basket of goods because they're worried about someone else in the family having an allergic reaction, which I understand, but I think defeats the purpose of the guidelines that say everyone should do early allergen introduction if you're then not going to offer peanuts as even a DIY opportunity for people to do at home. There's a number of reasons why it really makes sense for this to be a Medicaid sponsored opportunity, both from the ROI perspective as well as the mission side.
No, that makes a lot of sense. So, last question, as we look ahead to the future, what excites you about your product?
There's a couple really exciting opportunities. One is that there's similar pending legislation now in New York, Kansas, and Illinois. And Delaware has been such a great leader, but having a larger state with a larger population take the lead on this will really help accelerate momentum. Our goal is to get much wider coverage within Centene, working on a pilot that will be launched with Aetna, and really get widespread insurance coverage for early allergen introduction. This is something that really should be covered, and it would make much more sense for everyone, both ROI wise and also making parents feel like this is really medically supported and part of the guidelines, knowing that it's covered. That's one aspect that is really tangible and will come in the next year, is much more widespread insurance coverage, whether it's through mandates or through just expansion based on the really great success we're seeing with 25% opt-in rates, et cetera. There's also exciting opportunities in science that on the early allergen side, we know that covers 70 to 80% of allergies, but there seems to be combinations of probiotics for babies, skin barriers for babies that should address more than just what we're doing, because there's been a dramatic rise in the rate of eczema, which is one of the fundamental causes of food allergies. But if we don't also do something to address eczema, then we can kind of paper it over with early allergen introduction, but we're not really addressing the full atopic march. And I think that's something that's really exciting for me is step one, widespread insurance coverage for early allergen introduction, so we can make sure every family has the best chance of not getting food allergies with their baby. And then secondarily, doing something more widespread about the atopic march in general.
Thank you for sharing your time and your work with us.
Thank you for all your help and getting the word out about early allergen introduction. It's definitely going to help save more babies from getting food allergies.
So we recorded these interviews, and then after recording them, there were a few new pieces of information that came out. There was a study that came out in the Journal of Pediatrics, and it reported that peanut allergy rates amongst children in the U.S. have dropped by 43% over the past decade. The risk fell from 1.46% to 0.93%. Experts say the biggest reason is early introduction of peanuts, which is something we talked about on the episode. As one researcher who was quoted in the article put it, "We're training the immune system, not avoiding the problem." I'm going to link to the New York Times article that summarizes this study really well in the show notes, but it reinforces some of the messaging we heard in the interviews today. And then separately, there was an article that came out about a company called Allergy Therapeutics, and they're working on and they've built a peanut allergy vaccine. It's called VLP Peanut, and they shared their early clinical trial results. It seems as though the vaccine uses virus-like particles to safely present peanut proteins to the children who get the vaccine. And so far in phase 1 and phase 2A trials, it seems like it's successfully reducing allergen reactions while boosting protective antibodies. So it'll be interesting to see how these two different research studies continue in this space, because it seems like the evidence continues to grow. I know I've said this before, but we talk about a lot of topics on this show. Today we talked about a lot of clinical topics, specifically food allergies. On this show, we're not endorsing any of these products or any of these techniques. Food allergies are really serious, and you really should talk to your pediatrician about what's best for you and for your children. All right, thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time. The content, views, opinions, and information presented on this podcast do not reflect the views of Children's Hospital Los Angeles or of the sponsors of the podcast. CHLA does not endorse the views, opinions, and information presented on this podcast, and CHLA specifically disclaims any legal liability or responsibility for the podcast content.